Hi YouTubers, welcome to another COVID-19 update. Today I want to talk about the kids and the success story of the Vietnam response to the pandemic. So, last night I was talking with my son who's currently living in Vietnam. And he pointed out that at the present time, or as of the beginning of April, they've been in lockdown there, but that they have hardly any cases there relative to most other countries. And I said, really? And I checked the numbers and verified that he was correct. And I asked him, well, how do you explain that? What did they do? And he really didn't understand why that was the case. So I said, well, let me see if I can find anything. So I did some searches and I came up with some information that I found very intriguing. And so this is what I learned. So back in January, in Vietnam, they celebrate their New Year's. It's a Tet New Year, and schools are out for a week for this holiday. The Vietnamese or the Vietnam government opted to not reopen the schools because of the COVID-19 pandemic. Even though they had very, very few cases at that time, they thought it was appropriate to take that precaution. It wasn't until April 1st that they had their shelter-in-place lockdown type order, similar to what it is in most states in the United States now, where you only go out if you need groceries or medical care or whatever. During the first wave of COVID-19 in Vietnam, they only had 204 cases and no deaths. Now, you could argue, well, maybe they're not testing as much, and no, they aren't. But there's a limit to how much of this you can hide in a country like Vietnam, especially in the bigger cities. If a lot of it were going around, the people would be getting sick and filling up the ICUs, and this was not happening. So I looked to see, what did they do? Was there anything that could possibly explain this? So a lot of the things were very similar to what other countries had done, including the United States. So, for example, they stopped traveling to and from China. They made every person who arrived from another country go under mandatory quarantine for 14 days, not just China, any country. They used close contact tracing of any suspected cases. And the people there are, I think, more, infection conscious. They've gone through prior epidemics with SARS and MERS, etc., more recently than us. And but the thing that jumped out at me was, and which seemed very, very different than other places that I've seen. I don't know of any other countries that have done this. There may be. I just don't know of them. Their Lunar New Year is January 25th. And they close the schools for a week for that. and they chose not to reopen, and the schools are still closed. Now that gave them a 9.5 week lead in closing the schools from the point in time when they closed the schools and when they decided to have their shelter in place lockdown order. So meanwhile, even though they're currently sheltering in place now because they have had an increase in cases, the number of cases is minute compared to many other countries, such as the United States. So, and then I thought about it, and I said, this really makes sense because if you're a parent, if you're a school teacher, or in my case, a pediatrician, and you're dealing with kids on a regular basis, you know that they catch everything that's going around and they spread it to everyone else around them. And, especially in a setting like daycare, and you try to get these kids to be socially responsible and follow instructions. I mean, there's a limit to what you can get the adults to do, let alone the kids. So I think that I think we've been underestimating the role that kids may be having in spreading the infection. Now, you'll remember that when kids get this, they are much less symptomatic or totally asymptomatic for the most part. So you don't see it coming. As far as you know, these kids are fine. They're healthy. But do you socially distance from your kids? You don't hug them. You don't kiss them. You're not sharing everything with them. And if they're a toddler and in diapers, you're not, constantly being coated with their secretions. So I'm just thinking this school order to keep the schools closed is very, very interesting. And I think these, we won't know until the antibody tests are done on kids to know how many of these kids have been getting infected. The rate of infection among kids may be just as high as it is in adults, but if they're not showing symptoms, who's testing them? We're not testing them. I mean, a few of them, but hardly any. So you don't know that they don't have the same percentage infection as adults, at least not yet. We'll get that information eventually, but we don't have it now. And then you've got the governor of Florida, I hear on the news today, who's, chomping at the bit to reopen the schools in Florida. There's a lot of craziness going on out there nowadays, coming from the top mostly, but it just doesn't seem to stop. And but I just wanted to point out this observation that how the heck does a country like Vietnam, that is poor, has relatively little money, little resources, its medical care system's nowhere as good as the one in the United States, it doesn't have the ability to ramp up the testing like we did. How did they manage to contain this thing? What did they do differently? And when I look at this thing, that 9.5 weeks school closing prior to the shelter in place jumps out at me, and I'm thinking, whoa, look at that. Maybe we're not giving enough weight to the role that kids are playing as invisible disease vectors in our society. So, thanks for listening. Again, my opinion.